Do you know what pelvic inflammatory disease is? This condition, often referred to as PID, occurs when the female reproductive system becomes infected or inflamed. So what parts of the body are we talking about? Well, PID can affect various areas, including the cervix, which is the opening of the uterus and endometrium, that's the lining of the uterus, the fallopian tubes, which connect the ovaries to the uterus, and finally the ovaries themselves, the organs that produce eggs. Now, PID can manifest itself in several ways. It might cause pain in the lower belly and pelvis. However, it's not always that clear-cut. Sometimes people with PID may not experience any symptoms at all, making it a bit of a stealthy condition. Now that we know what PID is, you might wonder what causes it. Let's explore. What causes PID? PID, or pelvic inflammatory disease, is typically brought on by a bacterial infection. These bacteria often hitch a ride through sexually transmitted infections, like chlamydia and gonorrhea. But it's not just STIs. Sometimes other culprits like a burst appendix or infections in the bowel or vagina can also set the stage for PID. Now let's talk symptoms. They can be as varied as the individuals experiencing them. Some may feel a nagging pain in the lower belly. Others might notice changes in their menstrual cycle or in their vaginal discharge. Some may experience bleeding or pain during sex, while others might battle fevers, nausea, and even vomiting. But here's the kicker. Sometimes, PID can sneak in without any noticeable symptoms at all. That's why it's important to be aware and proactive about your sexual health. While these symptoms sound concerning, the risks of untreated PID are even more serious. What are the risks of untreated PID? Pelvic inflammatory disease, if left untreated, can lead to serious complications. One of the major risks is infertility, or difficulty getting pregnant. This is due to the damage that PID can cause to the female reproductive system, particularly the fallopian tubes. Another risk is ectopic pregnancy, which is a pregnancy that occurs outside the uterus, usually in the fallopian tubes. This is a life-threatening condition that requires immediate medical attention. PID can also cause long-term pain and damage to the reproductive organs, further complicating a woman's reproductive health. But how do we diagnose and treat PID? Doctors typically conduct physical exams and tests such as blood tests, urine tests, and ultrasounds. The main treatment for PID is antibiotics, and it's important to avoid sexual intercourse until treatment is completed. In severe cases, surgery may be necessary to repair or remove damaged tissues. Prevention is better than cure. So how can we prevent PID? How can we prevent PID? The key to prevention lies in three main areas: safe sexual practices, regular testing, and paying attention to symptoms. First and foremost, practicing safe sex is crucial. This means using protection during intercourse, limiting the number of sexual partners, and avoiding sexual activity if you or your partner have an untreated sexually transmitted infection. Secondly, regular testing for sexually transmitted infections is essential. Don't wait for symptoms to show up before getting tested. Early detection can prevent PID and other complications. Lastly, if you're experiencing symptoms like lower belly pain, menstrual problems, changes in vaginal discharge, or pain during sex, don't ignore them. Seek medical help immediately. These could be early warning signs of PID or other conditions that need immediate attention. Remember, your health is in your hands. Stay safe, get tested regularly, and seek medical help if you have symptoms.